Hey guys, this is Luis Moreno with Insurance Agent Training. Today, we're going to be talking with Lucy from Advanced Diabetes Supply. Now, before I let her go into her presentation, Lucy, thank you for being on today.
Thank you.
So glad to have you. Agents, what Advanced Diabetes Supply does. Well, first, I'm going to back up a little bit. This is something that our clients need. It is a service that they provide to our clients, not just Medicare, but also the under 65 ACA market. It is a service that they provide to our diabetic clients. And the good thing is, all these people are going to do is they're like our what's a good word for this? They are going to help us out. That's the big key. Is in what they provide, we're going to benefit, but more importantly, our clients going to benefit. So, with that, Lucy, let's get into what Advanced Diabetes Supply does for clients and in how we agents benefit from that.
Perfect. Perfect. Thanks again for having me, Luis, and welcome to everybody who's coming on to learn a little bit about our agent support program. So a little bit about who I am. Let me just get this little screen out of the way here so I can see what I'm doing. Okay. I am your point of contact. I'm a senior account executive working with agents who live basically, for me, my states are Texas and Florida, but it's important to know that we do service nationwide. So if you are living in another state other than the two I just mentioned, let me know and we can get you connected with your point of contact. I specialize in diabetic testing supplies, and my focus is to support you to improve the retention and grow your book of business. And before we dive in, last year we surveyed agents that use ADS, and over 600 agents replied to the survey. What we learned shocked us. I've got new word of mouth referrals due to clients' experience with ADS, and the majority either strongly agreed or agreed. And this is exactly what we do. We want to make sure that we help you continue to grow your book of business. 30% of the agents who participated in that survey claimed to have gotten new word of mouth referrals due to their clients' positive experience with ADS. And instead of an empty promise of what we claim to do, I figured it'd be nice to share what we've already done for others just like you. So here's what agents who work with us have to say. I actually use ADS for my own supplies and have been satisfied with the service. This is true. I have a lot of agents who are living with diabetes and they are clients of ours. ADS is the best, knowledgeable, professional, fast, just what every agent needs for their clients. I absolutely love how simple you make it for my diabetic clients to get their supplies. You all communicate well with me throughout the process. And the last one's one of my favorites because I tend to be that person. I appreciate having access to an expert. I don't know that I'm an expert, but I've been doing this for a lot of years, and so therefore, I guess I'm considered an expert on all things related to diabetic testing supplies. I find this confusing at times. Diabetes testing supplies can be very confusing, but I know who to call when I need help. Having direct access via phone, text, email is absolutely invaluable. So it's good to know that you have someone in your pocket whenever you need to have a question or have doubts or are not sure. Please feel free to call. I am here to be a reliable resource for you. So a little bit about ADS and how we can support you and how you can take advantage of us right now. So what is ADS? We are a diabetes pharmacy supply. We are nationally accredited by multiple organizations. We do follow Medicare guidelines. We were founded in 2002, so we have 20 plus years of industry expertise in diabetic supplies. So in other words, we are the experts in diabetes. And how the agent support program works. First, you find your clients who have diabetes. You send their info to ADS. We call them for you, set them up for home delivery. We are basically a full service concierge support to the agents. There are agents that know nothing about diabetes. They don't want to know anything, and that's okay. That's why you have us. And it's really that easy. And before I forget, we provide this service at no cost to you. And now let's break down how this actually all works. First, finding your clients with diabetes. Statistics show that about every 3 Medicare recipients, 1 in 3 are a diabetic. There are places in the nation, in the country, that can be 2 out of 3. These maps show you the information on the far left. As you see, the blues are not that deep as far as the color of the maps. And as you go further to the right, as the blue progresses and gets darker, that is the propensity of diabetes on the rise. And so it doesn't look like it's going away. It's certainly not going away. Yeah.
Out of
And
curiosity, Lucy, and
yeah,
this may be a little technical, why do we see a lot more blue as we go from '06 to 2012 to 2019?
yeah, it's just diabetes on the rise. It just is. And it doesn't seem to be going away. And unfortunately, they're getting even younger. So it is an epidemic. And we're here to help. I mean, it's out there.
Yeah,
We haven't.
it doesn't look good.
It doesn't look good. So yeah, any of those that are type 2, there is help. There's ways of curbing that. Type 1 is a little more difficult, but either way, we are here to service those members that are living with diabetes and need some help.
Gotcha.
Okay, so finding your clients with diabetes. I tell agents the secret is ask everyone. When AEP is around the corner, or when you're checking your existing book of business, ask your members, do you check your blood sugar at home? Has your doctor said you should be checking your blood sugar at home? If anybody says yes, that's someone we can help for you. Remember, 1 in 3 Medicare recipients will be checking their blood sugar, and that's who we can call for you. What does it look like to send your client to ADS? First, you get your client's permission to send their contact info. We call them for you. This is by far the most effective way for us to support you. You're going to tell them, I'd like to get you set up with advanced diabetes supply. They help my clients who test their blood sugar. Is it okay if I have them call you to take care of your supplies? Yes, that would be great. You're an amazing agent. I'm going to introduce you to all my friends and family so you can help them with Medicare too. And really, that's just as simple as it is. And this is how it works all the time. So what does that call look like? The ADS team calls your client on your behalf, always referencing your name. Hi, Janet. Luis Moreno, your insurance agent, asked me to give you a call to get you set up for home delivery of your diabetic testing supplies. ADS calls for one specific number. It's that one right there. I always tell agents, save that number if you're meeting with your client in person. See if you can help them save that to their cell phone as a safe number to answer. A lot of agents are training their clients not to answer calls they don't recognize, which is great advice, but it makes it a little difficult for us when we're trying to reach them and get them taken care of. So it's important
Lucy,
that they know. Yes.
if you don't know this yet, with the latest iPhone update, they are now, if you're not in their contacts, that call is not going through anymore. It's getting screened by Siri.
Oh, wow.
Yes.
Okay, I didn't know that. That's good to know.
Yes,
and that's one of the reasons it's very important to let your agent know or your client know you're going to get a call from this number, so save it. Usually what happens if we can't get through, if there's a voicemail available, we will leave a voicemail. We will send a text. And after many attempts, we will even send a letter. Usually by then, I'm reaching out to the agent who referred saying, hey, I can't get a hold of Janet. Can you please reach out to her or ask her to call us or tell her we're calling from this number? So we want to make sure that we get in touch with that member right away because we do have to make contact and let them know that we're going to be taking care of their supplies for them.
Cool.
So yeah, thank you for that bit of information. It's good to know. So what does ADS handle for your client next? Once we speak with them, we are going to fax a prescription over to the doctor's office. If there's a pre-authorization that's required, we will file for that or get that. We verify and bill the insurance properly, and we ship their supplies directly to their home or their post office box free of charge to make sure they're getting their supplies. Okay, now which supplies do we handle for your clients? Let's take a look at the types of hardware ADS carries. Now, you don't have to remember any of these next few slides. This is our wheelhouse. You really, truly just send your clients over to ADS, not know anything about diabetes or supplies, and still win big. So the traditional testing supplies, the blood glucose meters, we carry not only the One Touch, but the AccuCheck, and there's many, many others that we service. The One Touch Vario used to be pretty much the formulary for most of the carriers. A lot of changes happening for 2026. They will not be using that as their formulary meter anymore. We do service it. The AccuCheck may be the one that is going to become the formulary meter for most carriers and others. And so not to worry, we service all the meters that are covered through the insurance to make sure that they get their supplies. The meter, the strips, the lancets, the lancing device, and the control solution is a full kit that is covered by Medicare Part B. And almost always, I want to say 99.9% of the time, there are zero copays for Medicare beneficiaries. So all clients with diabetes qualify for this type of product. Now,
Guys,
here's one of the things. Yeah, go ahead.
But on the Medicare Advantage plans, if you don't know this, they don't even have to be on a chronic plan for them to have this coverage. Diabetic supplies are covered with a $0 copay. Now, here's what I see a lot, Lucy, is these clients know they're getting their medications through the prescription side of the MAPD, but I do see them a lot buying these supplies at their pharmacy or at their grocery store. They don't know that it's covered.
That's correct. And that's because retail pharmacies bill very differently. They don't bill under the Part B. And a lot of times they're busy doing a lot of things. And you've got a member that walks in with the prescription. I need a new meter. They'll give them whatever's on the shelf. They're not checking to see if it's something that's actually covered through the insurance. There's the copay. And then every month that they're buying strips to match that meter, there's another copay. Some people are paying $40, $60, even up to $120 a month for strips in error. So we make sure that's not happening because we don't want anybody getting upset, coming back to the agent. You said this was covered. How come I'm paying? You don't want a rapid disenrollment. We're going to make sure none of that happens from the get-go. So we make sure they're covered with what is covered through the insurance at 100%.
And so all that's a great start. Guys, for you all, think about it. They're paying anywhere between 40 to 60 bucks for these supplies. Now you just uncovered $40 to $60 that you can maybe use for a final expense policy or something else that may benefit them.
Correct. Or even apply it to some of the medications that some members might be on that are very, very expensive and perhaps not covered or have high copays. So yeah, we want to avoid this at all costs.
Correct.
Continuous glucose monitors is next. So this is a very, very popular item. You see more and more commercials on TV advertising the Freestyle Libre by Abbott or Dexcom. These are really great, amazing technology for diabetes management and quality of life. These are the sensors that they wear on the back of their arm or on their belly. Medicare costs can range anywhere from 0 to 20% per month on most plans. And it's important to understand a lot of people are asking for this. Who is eligible? So I get calls all the time. Which are the carriers or what plans cover this? Any Medicare plan covers these devices. The member must be eligible. The Medicare guidelines for eligibility are either your client is injecting insulin at least one time a day. They must be insulin dependent, or they have a history of their blood sugar dropping below 54, one or the other. If they don't fit this criteria, they still have to check their blood sugar and we can service them with a meter and strips. And we're very, very clear with the members when they are referred over that we ask these questions of whether they are using daily insulin. A lot of people think that when these once a week medications like Ozempic and other things that are on the market that are once a week, those are not true insulins. They must be on an actual insulin daily. So that they are eligible. These are hard rules followed by Medicare, and we have to submit that paperwork to the insurance for them to process the claim. And so therefore, it's either they are on insulin or on the extreme opposite, their blood sugar drops very, very low. Because these items are expensive. They were designed to control the very highs or very lows. And so this is why these items are out there. Not everybody's eligible. I usually tell members the good news and the not so good news. If they really have their heart set on it, but they're not eligible, I do tell them, the good news is you're not on insulin, so that's good news. The not so good news is you're going to continue to poke your fingers because that's the only other way of checking your blood sugar. So I try to let them know, and we do everything we can to get them serviced with whatever it is that we can assist them with.
Lucy, how does ADS verify, where the client says, you know what, yes, I am taking insulin?
We're going to request a prescription from the doctor's office that
Okay.
shows that they are a diabetic, and on that prescription, it shows that they are using insulin.
Okay.
And we also have to have the last 2 doctor visit notes that have to be submitted to insurance.
Okay.
That usually in there shows that they are being treated for either hypoglycemic events or their blood sugar with insulin.
Okay.
Yeah. So that's the paperwork that we have to collect to submit. Insulin pumps and supplies. So these are Part B items, the Medtronic or Tandem brand pumps. These have reservoirs and cartridges that hold the insulin, infusion sets that are tubes to deliver the insulin. We expect a 20% Part B coinsurance. That could be anywhere between $30 and $50 per month. We're going to see what the coverages are looking like for 2026, but overall, these are Part B items. And this is also the one and only time that insulin will be covered under Part B, because Medicare says that if you are using one of these insulin delivery systems, the insulin has to go with it. And so therefore it is Part B, and it's still covered under the $35 cap for those insulins that are covered.
So let me see if I can get this right. So 20% coinsurance for the pump.
Correct.
Okay, and that's a monthly charge.
That's correct. And some of these, like duals or chronic plans, may be covering at 100%. So depends on the plans. We run it and we find out what the coverage is, and we will inform the member before anything ships. Of course, we will always tell them if there's some sort of cost involved.
Got it. And then so in addition to that 20% for the device, the insulin that goes in there, there's a $35 copay monthly.
That's correct. Okay. That's right. Yeah. All right. And then Part D items. So there is another insulin delivery system that is becoming more and more popular, and that is that Omnipod system. It's a patch that has the insulin that they also put on their belly. When that insulin is gone, I believe they just remove the patch and replace it with a new one. It's a disposable insulin delivery system. Therefore, it is covered under Part D for drugs. So that's the only one that is a little different. And of course, the insulin will be covered under Part D on that item as well. The syringes and pen needles in order to inject, and alcohol wipes, these are all Part D items. And again, just a reminder, the Omnipod is not a Part B pump, and insulin is still covered through the Part D. Okay, so that's a lot of info. Let's take a step back and remind ourselves of the big picture. You have clients with diabetes. We call them for you. We make you look great. We send them their diabetic testing supplies. We do this at no cost to help your business grow and, of course, retain that client. And in case you're still on the fence, last year, over 6,000 agents nationwide chose to use ADS services for their clients with diabetes. We are the industry gold standard, so we're excited about that. So how do you get started today? For anybody who is watching this, start asking any new potential clients, do you check your blood sugar at home? If it's a yes, that's someone we can help. That QR code is a direct referral link. It is by far the best way to refer. That information comes directly to me and our intake department. We reach out on your behalf. The minimum I need, I know we're going into AEP. A lot of people don't want to fill out another form. I just need basic information: name, date of birth, phone number, the agent's name and email, so I know who referred, so that I can say thank you. If you are looking at your last 3 to 6 months of enrollments for your clients, check and see who are your members that are getting diabetic supplies or need them. Mrs. Smith, I see that you are a diabetic. Are you getting your supplies, and are you paying for them? It's always a great way to check in with your clients and see if we can help them if they are paying for them, to make sure that hopefully they're not paying for supplies that they shouldn't be. So that link there, I could either text it to you. You can use it on a laptop. It works either way. And here is my contact information. If anybody wants to take a screenshot, that is my cell phone. You can call me and text me at any time. My email. And for anyone who would like to get started right away, send me your information, text me, and I will reach out and get connected with you. And if you're not in the states that I service, I will put you in contact with the person that is your point of contact for that state. So with that, Louis, that is my presentation. Do you have any
I have
questions?
some good questions. So number one, here's the game plan,
Okay.
guys. It's very easy. Okay. So once you find out that your client is diabetic, okay, whether it's insulin dependent or they're just on a metformin, they're taking a pill. Okay. Regardless, they're diabetic. All you got to do is say, look, I'm going to help you with your supplies. Okay. Very, very easy. I just scanned your scan on here, and it's like a two-step process. Step number one, you're going to enter all the information on your client. And I haven't filled anything out, but step two, I guess, would be the agent information.
Correct.
Okay.
Yeah. And as long as I just have a name and email, that's good enough.
Okay. Easy enough, guys. They take care of it. They get a hold of your client on your behalf. So they're going to make you look good. That's the key. It keeps them from potentially buying some supplies that would be covered and wasting some money. So here's a big question. Are you ready for this one, Lucy? Because I know agents are going to ask, and me personally, I want to know also, what carriers are you working with?
Okay, good. That's a great question. So we are Medicare. So anybody who's on Medicare, Medicare supplements, we also work and have national contracts with most of the major carriers: United Healthcare, Aetna, Cigna, WellCare. You know, there are a lot of smaller regional plans depending on the state that you're in. That's always a matter of just give us a call. If for any reason there is a plan that we are not in network with, we will always give your member instructions as to who to call, which usually is the prescription number on the back of the card, or we will tell them, call the pharmacy that you're working with, or call the pharmacy, on the back of the card. If we don't give them the actual phone number, ask them who your in-network provider is. So we will always direct them, and we usually let the agent know we're not able to service them, why we were not able to service, and what we did with the members, so that they know they're being taken care of either way.
Perfect. Now, that's Medicare. What about the under 65 ACA side?
That's good. So all of the national contracts that we carry that have that IFP plan or product are also individuals that we can service. So we do service the ACA if that plan or that product is part of our national contracts with the carriers that I just mentioned. We can service them as well.
Okay. And you went through that list, and I didn't hear Ambetter. Ambetter's pretty huge. You don't do Ambetter?
We do. I believe it's part of the WellCare contract.
It is part of the WellCare, yes.
Yeah, okay. We can service Ambetter. We've had very good luck with the Ambetter plans. I'm able to service a lot of those.
So I'll go through them. Ambetter. So on the ACA Medicare side, she mentioned already. On the ACA side, Ambetter, United Healthcare.
Yep. Yes.
Aetna is checking out. They won't be in the market in 2026 for MCA. How about Oscar Health?
Oscar Health, I believe we're not in network with right now.
Okay, so no Oscar.
No Oscar.
Let's see, I know I'm missing a big one. Molina Healthcare.
Molina, I may be able to assist with the traditional meter and strips. That's one we can, I can look into.
Okay, Blue Cross Blue Shield.
Blue Cross Blue Shield right now, I'm only able to service meters and strips. We're not fully contracted with them for the CGM business, but we're working on it. So yeah.
So I think what might be easy for agents, hey, just tell them, hey, they might be able to help you out. I'm going to send them your information. They'll get a hold of you. Worst case, if they can't help you out, hey, you're going to work with the benefits that you have on your plan. Best case, they can work with you, and you get your supplies sent from them directly to you.
Correct.
So not a bad deal. I like that. No, as far as agent questions, those are the big ones.
Hmm.
The one thing that I would say as far as a takeaway, guys, I would tell you this. All that ADS can do for you is help you. Bottom line, they're just that little backup for your diabetic clients for them to get their supplies, and it's shipped to them. And once they get on the roll and everything is set up, I'm assuming that this is just ongoing. They get a box in the mail from you guys with their supplies.
That's it. And once we ship, they get 3 months worth of supplies. And we also follow up with them every 3 months to let them know it's time for a refill. We'll get them taken care of. And just so you know, even though we ship to their home, we are a home delivery service. We do not willy-nilly just ship and then they cannot shut us off. We do check in every 3 months. We have to have an okay. These are Medicare guidelines. And if for any reason they're not responding, we're going to call them. And eventually they will call us saying, hey, where's all my supplies? What we've been reaching out to you, but you haven't responded. So we do have to get an okay to ship. And
Pretty cool.
that
And
way they know
guys,
that it's coming. Uh-huh.
while you're watching this video, you see that QR code right under Lucy. Just take a picture of it. It's going to open up a site. And then what I would do is bookmark that site.
Yeah.
And that way you're talking to a client, you can pull it up and click, 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 enter their information, and you're off. Now, Lucy, what happens when let's say it's AEP for
Uh-huh.
Medicare, or
Yeah.
maybe OEP for ACA? Okay, let's
Uh-huh.
assume that they call you because you guys are constantly in contact with them, and that's where they're getting supplies. And they say, "Hey, Lucy, I'm not too happy with my plan. I want to change." What's your
Right.
process for a scenario like that?
Oh, it's a great question. I tell them I'm not your insurance agent, but Luis Moreno is. He's the one who referred you. Here's his phone number. Please reach out to him, and I will call him and send him an email as well to let him know that you are asking questions about your plan. So we make sure to refer them back. Your member is in good hands. You never have to worry about them being switched over to anybody else. Hence, another reason it's important to use that referral link so we know who referred them when these kind of questions do come up. We're here to work with you to support that member, take care of them. And, between the three of us, you, us, and your client, we should be holding hands and making sure that they're being well taken care of. So that's what we do.
Beautiful. And all this is going to lead to hopefully them staying with you as the agent for as long as possible, because we do love our renewal money. That's what we live on, Lucy.
Yes, I know. And there's been a lot of hard changes on new plans. So yes, we want to make sure to support the retention of those clients, make sure they're happy, and make sure that they are so happy that they might have family members or friends that they're going to refer to you as well.
Beautiful. And here's what I would do, guys. Down below, when you guys watch this video, in the description, I will put all of Lucy's contact information. And Lucy, is there a way you could email me the QR code so I can paste it in the description also?
Yeah, I can
Yeah.
do that.
Or maybe the slideshow. That would be if it's doable.
Or yeah, if you want to just add that or
Yeah, I'll add
yeah,
it as
you
a
can.
link.
Yeah, uh-huh.
Yeah, that'd be great.
That's
And guys,
perfect.
get all her info. I'll have it in the description. And don't forget, guys. And again, Lucy, thank you for being on today. I appreciate it.
Absolutely. Thank you. I appreciate you having me come on. And please, if you have any agents that have any further questions or doubts or can't seem to find something under an EOC, I'm happy to help to navigate that and find where these supplies are listed, because that can be a little confusing as well.
We need every edge, every tool that we can have to close our deals. Guys, we are September the 23rd. We're weeks away from AEP. So take advantage of it. Have this ready to go. Send your clients to Lucy. They'll take care of them, and you won't regret it. It'll be a good thing. And don't forget, her contact information will be down below. All right, Lucy. Hey, thank you
Thank
so
you.
much. I appreciate
Thank
it.
you. We'll talk soon, Louis.
Have a
Thank
good
you.
day. Bye-bye.
You too. Bye-bye.